Hello, my name is Brian McKinnon, a neurologist or an ear surgeon at the Shea Ear Clinic. I'm one of a very small number of physicians trained in surgery and medicine of the hearing imbalance mechanism. Is anybody hard of seeing? Well, certainly many people are, including me. And we wear these things, glasses, in order to improve our lives and the lives of others. We often encourage people to get their eyes checked routinely as part of their routine health care. But how many people think about their hearing in the same way that we think about our vision? Certainly if we had a problem with vision, we'd be very concerned, but many times patients have no concerns about their hearing loss, despite the adverse impact that it can have. Helen Keller was both deaf and blind. She said that blindness separates us from objects. Deafness separates us from people. And yet, we often are very resistant to getting the hearing loss that separates us from each other addressed. Not nearly as resistant in getting our vision checked from the objects that separate us. But very few of us take the time to realize how isolating hearing loss can be for ourselves and our loved ones. Think about the things that we miss if we misplace our glasses. Think about the things we miss if we don't take our hearing as seriously as our vision. Hearing is something that should be checked as carefully as vision, and yet we don't do that. We get our blood pressures checked, we get our cholesterols checked, we check our height and our weight, but no one asks if we can hear the instructions and the guidance we're being given. My goal as an ear surgeon is to keep people from being separated from one another. Hearing is one of the many great gifts that we have, and as we age, we do lose hearing as part of the aging process, just as we lose vision. But many people will hesitate to buy hearing aids because it will make them look old. That's not fair, because in truth, the hearing aids will very much keep you young. They'll keep you engaged, and they'll keep you involved in the things that you want to do that will keep you young. How often does a patient say, I'm having difficulty understanding what's being said to me? And yet they're told, aging, it's normal, it's to be expected, there's nothing they can do. Interestingly, there's a great deal we can do. As a matter of fact, hearing aids, despite its reputation, are one of the most cost-effective treatments available. Hearing aids will not restore you to your youthful vigor, your normal hearing. Glasses don't do that either. We rarely hesitate to get our vision corrected with glasses or contact lenses or surgery, and yet we have a great deal of hesitance to get our hearing corrected with hearing aids, hearing protection, ear surgery. And yes, there are some people who cannot be helped with hearing aids. Fortunately, that number is very, very few. And in those individuals, they can often be helped by such devices as cochlear implants and bone-anchored hearing aids. Now, some of you may be scoffing at this, and that's fine. There is a well-known radio talk host who has bilateral cochlear implants. Now, maybe there's some smoke and mirrors involved. However, it's interesting to note that a person whose career is based on hearing and communication has bilateral cochlear implants and, to the best of my knowledge, remains a rather successful and popular radio host. Maybe he knows the value of his hearing, and maybe we should appreciate the lesson that he's learned. Yet, typically in the U.S., it's 7 to 10 years between someone realizing they have a hearing loss and actually going ahead and getting seen for that. Worse, people certainly take their loss of vision, if it occurs suddenly, very, very seriously. And yet many people, if they suddenly lose their hearing, don't do anything for weeks or months or years, and by then, unfortunately, there's little that can be done to try to recover the hearing, though fortunately there is much that can be done to restore hearing through surgery with a cochlear implant or bone-anchored hearing aid. Approximately 900,000 people across the globe are recipients of cochlear implants. And the Shea Ear Clinic has one of the only adult cochlear implant programs in the Mid-South. Now, if you had a technology that could restore function as miraculously as a cochlear implant, you would figure people would be searching out for it, seeking it, and getting it. This is a treatment that's covered by insurance. And yet only 5% of people who are eligible for cochlear implants become recipients. Some of this reflects a lack of knowledge that such an opportunity exists. Some of that reflects physicians who don't know that their patients can benefit from bone-anchored hearing aids or cochlear implants. Some of this, quite frankly, is the difficulty of a patient having to acknowledge that they have a problem and they would benefit from surgery or other interventions to help with their hearing. Cochlear implant is not a miracle in truth. It's a surgery. It's a device. It requires a patient to learn. And yet, 95% of patients who receive a cochlear implant become users. They find it very beneficial. When I was a resident, I did my first cochlear implant. It was in a teenager who had gradually lost her hearing over time. As you can probably guess, as a teenager, being able to be with her peers, spend time with her friends, to socialize in school, were becoming more and more difficult. And she had reached a point where she would be appropriate as a candidate for a cochlear implant. I was still very early in my training, and for me it was an exciting opportunity to learn. And boy, did I learn. And yes, I learned the surgical techniques, the things to do well, and the things to make sure that a cochlear implant was a success. But more importantly, I learned the impact that that procedure had on that young woman. The tears that she had when they were activated were not tears of pain or regret, but of unspeakable joy of being able to hear, being able to communicate, of feeling like she was no longer isolated, no longer someone who could not participate with her family, her friends, and her school. Someone who didn't feel trapped. That moment was pivotal to me as a surgeon. It was with that moment and through my training that I began to focus on the treatment of the hearing imbalance disorders. It was because of that I became very much interested in cochlear implants and bone-anchored hearing devices for the treatment of the hearing impaired. From there, I went on to a fellowship at the University of Virginia, which was heavily focused on cochlear implants. Since that, I've spent much of my career involved in research, both clinical and basic science, on improving the outcomes of patients with cochlear implants, opening opportunities and access to patients to cochlear implants, and seeing if we can develop even better devices to achieve better hearing with the technology that we have. As someone who has dedicated their professional career to making that possible, I welcome the opportunity to do that for you and your loved ones. Thank you. It is my privilege to be a neurotologist or an ear surgeon. I'm board certified in otolaryngology and neurotology, which is the subspecialty involving medicine and surgery of the hearing imbalance organs. I'm a fellow of the American College of Surgeons, and I'm on faculty at the University of Tennessee Health Sciences Center. My area of expertise involves understanding and managing problems involving hearing, balance, conditions such as Meniere's disease and positional vertigo, as well as the surgical management of such conditions as hearing loss and imbalance. I work with Sims Murphy in the management of certain conditions such as acoustic neuroma, and I work with my colleagues at the Department of Neurology in the management of patients who have balance problems. In addition to those collaborators, we work closely with the Shea Hearing Aid Center to help those patients who have hearing loss gain the most hearing that they can and be able to enjoy their lives as fully as they can. I joined the Shea Ear Clinic in January of 2013, having spent time as an academic ear surgeon in a teaching role. I'm still actively engaged in the teaching of residents over at the University of Tennessee Health Sciences Center, and I actively engaged in research and lectured both in the U.S. and worldwide on the topics of hearing imbalance.